Welcome to Healthcare and You, your questions answered. I'm Danielle Knox. The Affordable Care Act became law in 2010. Also referred to as the Healthcare Reform Act, it requires that most Americans have health insurance in 2014. Now, what it means for you and your family can be confusing. So we've enlisted some of the nation's leading experts to help you understand healthcare reform. Welcome Dr. Steve Ullman from the Center for Health Sector Management and Policy at the University of Miami, and Linda Quick from the South Florida Hospital and Healthcare Association. Thank you both for joining us.
Thank you.
So today I want to get into this because I know a lot of people have questions. We're hoping to give them answers today. Can you explain what changes have already taken place as part of healthcare reform?
There are a number of changes that have taken place. The first one is that many people who were not able to get health insurance in the past now are able to. People who have pre-existing conditions, for example, and will not be charged more because of those pre-existing conditions.
What impact will healthcare reform have in 2014?
Well, it will make insurance more affordable for people. 90% of the people that are going to actually purchase health insurance will get some help with the premiums so that they can afford to pay for health insurance.
You know, I was at a small business earlier the other day, and they were asking so many questions. What did these changes mean for small business owners and for the self-employed?
Well, for small business owners, first of all, if they provide health insurance for their employees, they'll get a tax credit from the federal government. It's a significant tax credit. But also they have access now to an insurance plan that would be much more affordable generally than what they could afford before. And that's true also for the self-employed.
How can uninsured Americans get coverage starting in 2014?
They can go to healthcare.gov, and that will provide them information about the plans that are available. And they also, as they work through that system, can also get information about the subsidies they can access from the federal government.
Now, currently we are in that open enrollment period right now for signing up for coverage. How long will those eligible be able to sign up for coverage?
Well, the federal government has extended that opportunity till the end of the first quarter or March of 2014. But the sooner you get signed up, the sooner your insurance takes effect.
So let's say they don't do it. I mean, what happens to people who don't sign up for coverage?
There'll be a penalty. The penalty starts relatively modest the first year, but it goes up relatively significantly over the next several years.
I want to thank you both for being here with us. Thanks, Dr. Ullman, and thank you, Linda. And thank you for watching. And don't miss our second edition of Healthcare and You, Your Questions Answered, where we'll cover some insurance basics and what these changes mean for you and your family.